What is the difference between a MD and a DO? I'm a DO, Doctor of Osteopathy. So the difference is I went to Michigan State, and back in that time, in 1990, they combined both classes, the MD's allopathic and the DO osteopathic models. So we started in the morning the same classes, anatomy, physiology, biochemistry. At 3 o'clock, the MDs went home and studied. At 3 o'clock, the DOs tried to teach their doctors doctor-patient relationship, how to interact with a patient, manipulation like chiropractic techniques. More importantly, it was a philosophical difference. DOs were trained in biopsychosocial care, where, for example, an ulcer. The MD's allopathic model treated the ulcer as a disease. The ulcer is the disease, where the DO is supposed to biopsychosocial look at what caused the ulcer more than just doing the medicine. So importantly, the DOs are supposed to be holistic, and not all of them are, like anything. But the ulcer, in this case, is just a symptom. Do you hate your wife? Do you hate your life? Do you hate your job? That could lead to an ulcer. Are you drinking a half a liter of vodka a day? That could lead to an ulcer. You get a hangover, take 6 ibuprofen? That could lead to the ulcer. So if the ulcer is a symptom that your marriage is going very badly, well, you want to address that, get them into marriage counseling. Something like that is really important. But the ulcer for a DO becomes a symptom. It's supposed to be holistic. Biologically, you can secrete acid, make an ulcer. Psychologically, you hate your wife and life and job, that could lead to an ulcer. Socially, you're drinking alcohol like a fish, getting a hangover and taking a leave every day, that can lead to an ulcer. But you got to look at all three spheres together to see which one of those spheres or one or two of those spheres are out of balance, and then work on that from that perspective. That's the difference between a DO and an MD.